Hi everyone, welcome back. I'm Shirley Drummond. I'm a discovery agent and I assist my clients in protecting and creating wealth. One of the fundamental needs of a protection of wealth is to ensure that you have a good medical aid available if and when something goes wrong, an accident, an injury, an illness. We need to ensure that you have the right plan in place for what your medical needs are, what your financial circumstances are, and then marry those up so that we can find a plan within the Discovery Network that would suit both of those needs. It sounds complicated, and it truly isn't. We're going to just today look at some of the fundamentals, the basics of it. There are a lot more detail that we will then need to consider once we've established what plan we could potentially be looking for. So work with me through the next couple of minutes and let's just unpack exactly what is available within the Discovery Network. I'm going to try and keep it as simple for you as possible so that by the end of this, you would be able to understand what your plan offers you and what is available out there in the Discovery Network. Our first step that we'd be looking at is what we would call our core plan. Another name for it in the market is a hospital benefit, because predominantly what it's covering is protecting you for when you are hospitalized as a result of an illness, an accident, an injury. Hospitalization is when you've actually been admitted into hospital. So it's not for that casualty visit, perhaps to be x-rayed, stitched up, for example, and then sent home with some medication. That would form part of day-to-day cover. Hospital benefit is when you've done the paperwork, you stay overnight or you're there for a day procedure. Quite important to keep that in the back of your mind. In addition to the hospital benefit, we have our chronic cover, which also encompasses the oncology benefit, our maternity benefit. And essentially what that does is it gives you certain amounts of protection for chronic medication, for oncology benefits, and for our maternity benefit that is applicable to all of our plans that we're discussing here today. Screening and prevention, a certain set of medical tests that are available, paid for from the risk portion of your medical aid. We have our core plan. If during a consultation you said to me, but Shirley, I need to have additional protection for day to day, we would then look to add to that a medical savings account. That medical savings account is a pool of money that's given to you at the beginning of the year for all of your day-to-day visits. Your expenses, your doctor visits, your optometrist, your dental, any physiotherapy that you may need. That visit to the casualty where they needed to do an x-ray or stitch you up, that would all come out of this medical savings account if you had added that to your plan choice. If we add the medical savings account to our risk portion, that would be known as our saver plan. Our saver plan, pool of money given to you at the beginning of the year or pro rata, depending on when you're joining, for all of those day-to-day benefits. When that reached zero, if you were on the saver plan, you'd then be paying all of your additional medical expenses out of your own pocket. Again, if you said to me, but Shirley, I still need more protection. I want more peace of mind. We then look to include our next level of protection. That means that you would then start to pay a portion of money out of your pocket until you reached a limit. We call that the self-payment gap. Once you reach a certain limit, Discovery's above threshold benefit would then kick in. That above threshold benefit is another risk portion that would continue to pay day-to-day benefits. Once your medical savings account had been depleted, you'd paid through the self-payment gap and then moved into the above threshold benefit. That plan is known as our comprehensive plan. A core, a saver, and a comprehensive plan. The next element that you'd look to add in terms of considering what plan to go on to is what we call in the Discovery Health Rate. The Discovery Health Rate is a guideline of what practitioners potentially could charge for a particular procedure. It's a guideline from Council for Medical Schemes through the Discovery Health Scheme, and we look to use that Discovery Health Rate to then decide, do we have a classic plan? And in the event of a classic plan, we'd pay that practitioner 2 times that rate. We have an essential plan that would pay 1 times the Discovery Health Rate. At this stage, I want to just say we could potentially have a classic saver or an essential saver. We can appreciate that an essential saver would cost less because the protection is less. We know that practitioner can charge what they believe to be a market-related rate. That's their prerogative. If they are charging more than what the Discovery Health rate is and the classic plan of paying 2 times that amount, that's where gap cover typically would come into the market. That is a short-term policy that would give additional protection for hospitalized events and certain other chronic events from time to time, depending on which plan you're looking at. Having said that, we'll discover and go through the gap cover in an additional session. Today, we're going to just look at the health options. On our classic plan and our essential plan, that determines how much is going to be available within our medical savings account. It's quite important to realize that 25% of our premium is available in the savings, and on an essential plan, 15%. So again, when we're looking at the rates, an essential plan is going to appear to be a lot more cost effective than the classic plan. However, the protection and the availability of day-to-day savings is considerably less. Again, we're matching up what is your financial needs and your medical needs to try and find something that's going to suit both of those as best as possible. An alternative that we have, if you're looking to use certain network hospitals, is to introduce our Delta network of hospitals. The Delta network of hospitals is a list of hospitals that are available to our network clients for them to use those hospitals for planned procedures. It's important to know where you live, what hospital is in your close proximity, and the hospital that you're likely to choose for planned procedures. If that hospital is on the Delta network, this may very well be a plan that you could look to introduce. However, it's also important to know that certain specialists work out of different hospitals. You can go to those hospitals, however, co-payments would then be applied. The Delta network of hospitals is available on all of our plans that we've discussed so far. Our classic saver could become a classic Delta saver. Same benefits of the classic 2 times, saver plan with the medical savings, utilizing our Delta network for planned procedures. We have a smart plan that was introduced not too long ago. That smart plan utilizes a network of hospitals similar but not identical to the Delta network. Once again, imperative for you to go and have a look at what hospitals are on that list and is there one that's available close to your home. The smart network is called the smart because it uses smart technology. It's an app-based an app-based plan on your phone, giving you access to digital technology, a digital card, giving you access to a doctor within the smart network within a 5-kilometer radius of your location. So very geared towards our younger clients, using the technology and wanting to make benefit of the savings of using a smart doctor with a co-payment dependent on your classic or your essential option whenever you visit the GP. Very important to remember that if you are on the smart network, that you're going to then use the smart GP as your entry into any specialists that you may need from time to time. The smart plan offers private hospitalization with our smart network of hospitals, access to smart doctors with a co-payment, and additional benefits for injuries related to sports. Very important to know that the decision that you're making on your plan is not cast in stone. You do have relative flexibility, downgrades happening any time in the year, terms and conditions applicable. Upgrades, however, are only available during a window period when the medical aid opens up a time, typically between October, November, and December, for a start date of 1 January. So should you wish to upgrade your plan at any point in time, it's imperative that that action is completed in the window period and effective from the 1st of January. At that point, I'd like to just say thank you so much for spending the last couple of minutes with me. I do hope that it has added some value. Important to know that our team is available to go through and elaborate and answer specific questions for your needs. Hopefully the base, classic, essential, core, smart, or comprehensive, we are able to help you and put a plan in place for you. I do trust that this has been helpful, and I look forward to meeting with you again soon to chat about our gap cover and see how that may help and assist with your financial planning needs. Thank you so much. Have a great evening.